Let's talk about the risk factors. Some of the risk factors we have discussed when we were discussing in general about the risk factors of dementia. Let's try to sum up all the important risk factors of Alzheimer's disease. So we know age is one of the greatest risk factor. More the age, more the increase in risk. Education, again, less education is again implicated as an increased risk factor for Alzheimer's dementia. Head trauma again is very important. It can also cause Alzheimer's dementia. Again, head trauma can lead to overexpression of APP. Again, so this may also implicate subsequently lead to A beta 42 and also can increase inflammatory mediators. Ultimately, A beta deposition occurs in the brain. Also, it is seen that the head trauma may also be mediated by ApoE gene. So various factors related to head trauma eventually can cause Alzheimer's disease. Inflammation again plays an important role in development of dementia. Again, it has been seen that in patients with Alzheimer's dementia in their brain, there is an increase of acute phase reactants, cytokinins, and complement proteins. So it has been seen that a lot of these pro-inflammatory markers, they are increased in the brain of patients with Alzheimer's dementia. And many of the population studies have shown role of NSAIDs, and that is non-steroidal anti-inflammatory drugs and corticosteroids to decrease the risk of Alzheimer's dementia. So maybe because of by decreasing the inflammation. But again, these studies, some refute these studies and some say, as it was seen in a 2005 meta-analysis, it was seen that many of those studies had certain biases. So some say that these drugs may have a role, some say that they may not have a role, and some say that maybe the timing of these drugs such as NSAID is more important. So giving them in the early stages may help, but giving them in the later stages may not have much effect. So still again, it's controversial whether these drugs help or not, but eventually we know these drugs, these non-steroidal anti-inflammatory drugs, again, they have their own risks such as bleeding, cardiac toxicity, especially in elderly. So again, one has to be careful when we interpret these studies. Now, then other important risk factors are oxidative stress. Again, it has been postulated that oxidative stress may also increase the risk of Alzheimer's dementia. Now, it has been seen that A beta as well as the microglial inflammatory reaction which occurs around the plaque, they by oxidative stress eventually they lead to damage of the neurons. So the neurons are ultimately killed by oxidative stress. So oxidative stress again plays an important role. In fact, it is seen that in brains with patients with mild cognitive impairment, that is MCI, there is increased markers of oxidative stress. So again, it has been postulated that antioxidants should be evaluated for the treatment of this dementia because they may have some neuroprotective role. Again, certain antioxidants have been tried such as vitamin E, but in 2011 Cochrane review there was no convincing evidence whether these antioxidants they have any role. Even ginkgo biloba, again, this was also evaluated, but again, there is no convincing evidence. So you may find that, some of the studies may acknowledge that they may be helpful, some may refute. So again, antioxidants may have a role, but till now, we don't have a concrete evidence that they are useful. Then other risk factors include, as we have discussed, vascular risk factors not only increase the risk of vascular dementia, but also even Alzheimer's disease. Even depression we have talked about can increase the risk of Alzheimer's dementia. Environmental factors, certain exposures again such as alcohol, nicotine again have been suggested to increase the risk of Alzheimer's disease. Let's talk about nicotine. Again, there is certain contradiction in literature and there is again some say it increases the risk, some say it decreases the risk. So let's try to understand the nicotine stand on the risk factor. So it is shown in certain case control studies that the risk of Alzheimer's dementia may decrease. It is shown that it may modulate a neuropathology by oxidative stress and inflammation, and in vitro it has also been shown that in many animal studies it has been shown that it protects the brain against the A beta toxicity. So certain evidence is there that it decreases the risk. On the again contrary, there are certain evidence such as in cohort studies, it has been shown that the risk is increased. So again, there is a debate whether it increases or decreases. Acetylcholinesterase inhibitors, again, when we'll talk about, they also indirectly stimulate the nicotinic receptor. So again, there is some implication in the treatment as well. But even if we see that it may be useful, it is difficult to use nicotine as a drug because we know it has a lot of cardio and cerebrovascular risk involved with it. But one should know, yes, nicotine, again, there is certain evidence of increasing or decreasing the risk. Now let's talk about some of the important protective factors. We've talked about some of these factors such as Mediterranean diet may decrease the risk, increased physical activity, increased years of formal education, again, may be related to protecting or may serve as a protective factor for Alzheimer's dementia. Let's try to understand the role of estrogen. So again, there is certain evidence related with estrogen. Let's try to understand some of these evidences related with estrogen. Now it is shown that estrogen may increase the density of the synapses onto the dendritic spines, which are lost in Alzheimer's dementia, especially in hippocampus in the cortex. So again, it may help in patients with Alzheimer's dementia. It may interact with APP processing, and again, it may increase A beta concentration at times. In vitro, it is shown that it inhibits oxidation of lipids, lipoproteins, nucleic acid, and protect the cells from A beta damage. So again, there is some role of increasing and decreasing the risk. It is seen in observational studies that estrogen replacement after menopause may decrease the risk. But many prospective studies, RCT done, they have very little evidence of improvement. Again, one important factor which has, people say is timing. So many say that giving estrogen in the early postmenopausal phase or even in the perimenopausal phase may have effect, but giving it in a later stage may not have any effect. So again, there is certain controversy related with the role of estrogen as well.